All right. Hi there, everyone, and welcome to Making It on Mondays, our weekly workshop for mums in the making. Making It on Mondays is brought to you by the Acupuncture Pregnancy Clinic, which is an integrative traditional Chinese medicine clinic and an acupuncture clinic. And we are dedicated to reproductive health, to IVF support, and to pregnancy care. Now, these weekly sessions are designed to help and support those on their fertility journey. And we are all about empowering women who are trying to conceive through providing weekly workshops with relevant and research-based resources. Now, in these weekly sessions, we cover topics such as TCM fertility, nutrition, mindset, as well as tips from the experts, both inside and outside of our clinic. And today I am your host. And for those of you that don't know me, my name is Louise Jeffrey. I'm a traditional Chinese medicine practitioner, an acupuncturist, and a coach. And I've been in practice helping couples trying to conceive since 2010. Now, if you're on your fertility journey, you will know how hard it is to make head or tail of all the information that you research and that you find. And you will also know how hard it is to ascertain what is credible and what is not. Your fertility specialist can tell you one thing, the internet may tell you something else, your naturopath may tell you something different, and it can indeed be very confusing and overwhelming to know, what to believe and indeed what will make the difference for you on your fertility journey. Now, back in 2008, there was a woman with a vision to bring the approaches of East and West together into one clinic so that our patients could have an integrative model of healthcare as they navigate their fertility journey. And this woman is our clinic founder, Jane Lyttleton. Now, Jane is a renowned practitioner of Chinese medicine with 40 years of clinical experience. She has a degree in genetics and in Chinese medicine, and she completed her specialized training in gynecology in China. Jane is published widely in professional journals. She's lectured extensively throughout the world on the topics of both Chinese medicine and reproductive medicine, and she's an authority in the Chinese medicine practice of women's health and fertility. And Jane has also been an amazing mentor to us ACP practitioners over the years as our clinic has grown and flourished. So welcome, Jane. It's so lovely to have you here with us today.
Thanks, Lou. It's fine to be here.
Good. All right, beautiful. So we're here today to talk about the integrated model of healthcare as it pertains to fertility. And I suppose my first question to you is, I'd love to hear, how did the acupuncture pregnancy clinics come to be in existence? And maybe you can give us a little bit of backstory on yourself and how you came to have this vision for the clinics and how that all transpired.
Happy to, Lou. I'm not going to give you a lot of backstory on myself. There's too much now. In fact, somebody asked me in the clinic how long I'd been in practice, and I had to say to them, look, that's nearly as rude as asking how old I am now. The number is too big. So not too much backstory going back too far, but I'm certainly very happy to tell you the story of the clinics. And you know most of this, but let's share it more broadly. Going back now, well, as you know, this month it's our birthday, coming up next week. And
how many years is that?
14 years we will be. And yeah, there's been some evolution, development challenges, but I think we've just gone from strength to strength. So let's wind right back. And 2007, I took a year to travel and teach. So I started off in Shanghai at some seminars there, and then North America, and then Europe. And I was meeting a lot of very interesting colleagues and people, as you can imagine, with such a broad and wide-ranging tour. In North America, I met some interesting people who were doing a little bit like I was, like specializing in fertility, and some IVF specialists at some of my lectures. And of course, then we meet up afterwards and have dinner and so on. And out of that came an invitation to actually speak about acupuncture at an IVF conference in Palm Springs. So that's the PCRS, which is the Pacific Coast Reproductive Society. In America, they have two big IVF conferences each year. One, the ASRM, very well known, and everybody goes to that. And then the PCRS, a little bit more relaxed. They can have acupuncturists speaking there.
Yes.
This was a first, absolute first. Never happened before. And I wasn't the only acupuncturist. There were 3 of us, all presenting slightly different viewpoints to an audience of IVF specialists, nurses, and embryologists. So how did that happen? It happened because, as you probably know, and most of our viewers will know, that the concept of having acupuncture on your day of embryo transfer has been a very popular one for quite a while. Goes back to 2002, when a German group of researchers, guided by a Chinese doctor from Wuhan, did a trial looking at women having acupuncture on their day of embryo transfer and published some pretty compelling results. Small trial, but very good results. So from that 2002 to 2007, when I'm doing these lectures, there's another 10 papers are published, all of them in Fertility and Sterility, which is the peak fertility journal in America, with a great reputation. So there's a groundswell, and then some meta-analyses happen of these trials, and it's pretty convincing. Yes. So IVF. So now we're on the radar of the IVF clinics. This is something that they're noticing, and of course it's getting into the chat rooms. And so, as we all know, and many of us have done the same, when you're going on, if you're having fertility challenges or all sorts of different challenges, it's good to find a support group, and the chat rooms are often very, very helpful. So the chat rooms are full of acupuncture too. So I came home from that conference. This was in early 2008, very inspired by the conversations we've been having and by the potential here. And I thought, I'm going to take it to what was then our peak IVF clinic, Sydney IVF, or one of our peak ones, and ask them what they think about integrating acupuncture with what they're doing with their IVF patients. So anyway, I go to Sydney IVF. I talk to some of their doctors. They're really interested. In fact, we scope the whole place looking for room to acupuncture. But at that point, there wasn't enough room. So one of their IVF doctors and myself go off looking for other premises, but close by. And we found some beautiful rooms in an old heritage building in the middle of Sydney, looking down Martin Place. And we're still there 14 years later. So I started preparing a lot to open this clinic, because it had to be able to withstand a lot of scrutiny from the IVF clinics. Yeah. And it also had to serve a good purpose for the patients and be a good experience for them. Okay. So we started out being very, what we would call, evidence-based. All the research I did in the lead up to that was just going through all the trials with a fine-tooth comb, seeing exactly what they had done, how they'd done it, and when, and so on. And I even broadened it, looking at some animal trials, looking at other aspects of fertility and blood flow to the uterus, blood flow to the ovaries, and so on, dealing with stress hormones. And we created then a little manual, and it was only about 25 pages, had a number of different protocols based on this evidence largely. And it was very specific just for IVF patients. So, and it was very, at that point, we all were, a number of colleagues had joined me by then. We were all very outcome focused. Like the IVF clinics, what's the pregnancy rate? And so our protocols focused on what the patients were doing in the month before their IVF cycle and what they were doing while they were on the IVF drugs, particularly the FSH stim drugs. And we would focus on helping that process as much as we could for a good outcome, i.e. a positive pregnancy test. And of course, when we talked to the IVF doctors about that approach, they were right on board. Yep. And then talk to the counsellors and the nurses as well, because they're all interested in what we're doing. And they would say, oh, no, wrong focus. You need to be focusing on anxiety and stress that these patients are going through. So that was a very different way of us looking at it, but very useful. And for sure, patients were needing that sort of support. So we started then broadening our focus a little bit, because what we were doing up until that point was acupuncture before the IVF cycle, during the stim phase, on the day of transfer, and then we just wait and see. Exactly the same approach as the IVF clinics. But then after getting this advice from the counsellors and nurses, they would say, no, after the transfer, that's when you really need to be supporting these patients.
Oh, wow.
It's the toughest time for them. It was very good advice for us, and also opened my eyes a little bit to being a little bit more holistic than this very, very specific IVF support clinic. Anyway. So we got all our protocols right. We were armed with our manuals, and there was a very solid group of us, all of us very interested in this field and with quite good experience. And we opened what we call the Acupuncture IVF Support Clinic, which said it all. That's all we did. That's all we were offering, but we were very clear about what that was. And we opened it up on the 8th of August, 2008, 08. So a very auspicious date.
Yes.
It was kind of serendipity, but a little bit chosen for its auspiciousness as well. Because, as you may or may not know, the number 8 in China is considered a particularly lucky one. And that's because 8 in Chinese is ba, and ba sounds a little bit like the word also for good fortune or prosperity. So 8, if you can use an 8, it's going to bode well for you.
Yes. And you got 3 of them.
Yeah, we got 3 of them. And interestingly, I later discovered that the Beijing Summer Olympics started on that same day, or their opening ceremony was on that same day. But not only did they choose 08, they started their opening ceremony at 8 minutes, 8 seconds past 8 o'clock.
Wow. Beautiful. They had 6 of them. That's fantastic.
We didn't go quite that far. But, so 8's auspicious, but obviously multiples of 8 are even more auspicious. And then there was a nice little addendum to that story. Some years later, we've got an appointment system and a filing system that gives each client of ours a number. And some years later, one of our clients came in with a number 8888, 4 8s. That was a few years later. And she got pregnant. So we thought, yes, the numbers worked for you. And then fascinatingly, 3 years later, she came back for number 2. And her client number record worked again. So,
oh, good. I love that.
Bit of gossip. Anyway, so we hit the ground running. IVF patients were really supportive. The IVF clinics were really supportive, and everyone was really interested. And we offered a lot of acupuncture in that very limited sense of supporting what was happening in the IVF cycle only. So within a few weeks of opening, IVF doctors came from other clinics to visit us because they were interested in what we were doing and interested in us doing something near their clinics, not just where we were. And the next thing that happened was another conference. Conferences are really great for establishing relationships. FSA is Australia's Fertility Society of Australia, and they have an annual conference where all the IVF doctors go and the embryologists and the nurses. And later that year, or it might have been, and I think early the following year, we went to FSA, and one of those meetings in the corridor and the coffee room that produced results happened. It was myself and one of the directors from IVF Australia and Caroline Smith, who was from Western Sydney Uni. She was giving a paper on acupuncture and IVF. We just had a chat, and the result of that was they said, we want you to move into the premises next to our clinic in Maroubra where they had the day surgery. So we set up, it was a lot of rebuilding to do, but we set up in Maroubra. And since more recently, as you probably know, the Maroubra Clinic, the day surgery moved to Alexandria, and our clinic moved.
Yes.
So what then happened is we were operating very successfully within those boundaries, but then we started to get demands from patients, and we needed to broaden what we were offering. So, for example, a patient would come who had been through an IVF cycle and it had failed, and she'd come back and she'd say, I don't want to do any more IVF. What can you do for me with Chinese medicine instead?
Wow.
Or we'd have someone coming in who had done IVF and fallen pregnant, coming in and saying, look, I've had a positive, but I'm terribly anxious because last time I miscarried. How can you help me? Stories like that. Or someone coming in with endometriosis saying, I don't even think I can fall pregnant yet because I've got endometriosis. So what can you do for me? So bit by bit, and we have many, in those early years, we were having clinic meetings all the time to try and wrangle with this and, work out how we do our job best. And gradually we broadened what we were offering. And by doing that, we had to embrace more of a traditional Chinese medicine framework. We were no longer just evidence-based. And we were no longer just IVF support. So we became evidence-informed. One of the things that's particular about our clinic is we follow the research minutely, and we see exactly what impact it has, how relevant it is to our clinics, incorporate what's relevant. So we became evidence-informed rather than evidence-based, and we changed our name from the Acupuncture IVF Support Clinic to the Acupuncture Pregnancy Clinic, because suddenly we were doing much more than IVF support. And so our little 25-page protocol manual is suddenly hundreds of pages.
Yes.
It's a big volume now, and it kind of addresses just about everything that we have seen over the years, and we've seen more than 15,000 patients. So you can imagine we've seen a lot of scenarios. We've tried to think of solutions and appropriate treatment plans for lots of different situations.
Yeah.
And our big, fat, hundreds of pages manual, we've called the Manual of Everything, and it's affectionately known as MOET. And that's been the basis.
We love MOET. MOET is our friend in clinic.
Yeah, it is. It's a good resource. And it comes from our experience and as I said, patient-driven a lot.
And so for you, over the years, Jane, it's such, thank you for sharing such a beautiful synopsis of how, the clinic has kind of evolved. Obviously, the clinic itself broadened in terms of, of what we were treating. So not just IVF and embryo transfer, but obviously anxiety and stress, much more women's health as well. So broadened, in terms of endometriosis and dysmenorrhea and PCOS and all those things that come alongside and with fertility.
And male fertility too.
Sorry, and what's that?
And male fertility as well.
Yes, and male fertility, of course, too, which is obviously a big part of it as well. So do you feel, how has that journey evolved as well in terms of the IVF doctors? Do you feel that they've become more open to acupuncture? Or has it kind of that remained a little bit static as we've evolved?
It's been through various stages over the 14 years. At the start, everybody was very excited about acupuncture, mostly because of some meta-analyses that were published in very reputable journals. But the excitement waned not in terms of the patients, but in terms of the IVF doctors some years later. And partly that was because there was not good follow-up research. There was not, some of those trials, the results weren't repeated. There was one trial that was based in Australia and New Zealand that actually showed that doing acupuncture just like a couple of days before and on the day of transfer didn't change the outcomes. And that was quite a good trial. And so in terms of being dazzled by research, that definitely waned. So that kind of coincided with the time that we were branching out and seeing a much, much wider range of patients, including a lot of patients who weren't doing IVF but were still trying to conceive or were pregnant. So while we kept personal relationships with the IVF clinics, I had a feeling their interest in us as an evidence-based sort of clinic was not as strong as initially.
As it was in the beginning. Okay.
As it was in the beginning. And what's then evolved more recently, let's say, I don't know, the last 3, 4, 5 years, is that more research is being done and much more friendly towards Chinese medicine. You understand, and I'm sure everybody does, it's very hard to do a clinical trial that is double-blinded and placebo-controlled with acupuncture, because hard to blind patients, hard to blind practitioners. And when you set up a trial, you often have to have a very rigid protocol. So the same thing gets done with everybody. That's not really Chinese medicine. Fortunately, there have been some other trials and audits done looking at a slightly more holistic way of doing it, more the way we tend to see our patients now, where it's a very individualized approach. It's not just one protocol now. And it's done over a longer period of time. It's not just 2 or 3 treatments, because Chinese medicine, acupuncture in particular, is quite cumulative. And you can't really have a lot of influence putting needles in just twice in 1 week sort of thing.
Absolutely.
So those meta-analyses that have come more recently, we've got all of this on our website. Although if you want deep information, you have to email us for it, have shown that when you do a more holistic approach, you do the Chinese medicine approach in 2 to 3 months before the cycle, as well as during the cycle, the results are much better.
Yes. So I think the sweet spot is 8 sessions. Was that right?
Well, one of the audits looked at that, and they were doing between 8 and 12, like in the month before or even the 2 months before, and then during. So I would hesitate to say there's an optimum number, because who knows? Maybe if she'd looked at people having 20, it would have been even better. We don't know. They just they just analysed what happened in that particular time frame.
Yeah.
But it was a good, and fairly significant result. So we felt vindicated, really, in the approach we'd taken, where we had actually broadened our scope, because the research followed us in a way. And showed that actually that's better. That's better than just doing.
That's what they do in China anyway. They do a lot of preparation beforehand, not just necessarily, within a cycle.
Absolutely.
So almost like you say, come kind of back around again.
Yeah.
So we talked kind of about that.
Just to take that full circle, Lou. So while the interest in the acupuncture research waned on the behalf of the specialists, it's coming. We're finding much more support and interest again now, mostly because their patients tell them what they're doing.
Yes.
So they're just interested much more from the patient perspective rather than the medical journal perspective.
Yes, absolutely. And, we have the nurses saying, and they're our biggest supporters, because they say they can absolutely tell when somebody has had acupuncture. So somebody arrives on the day of the embryo transfer and they're like, right, we can tell you about acupuncture because you're calm. And all of our patients who come in, they'll say, like, I immediately feel calmer straight after my session. Yes. So we know that it calms the central nervous system. We know that it reduces stress and anxiety. And perhaps that's one of the biggest reasons why it helps our fertility, who knows. But yes, absolutely. And to kind of reiterate what you're saying around the specialists, we have, really good relationships with quite a few key specialists and doctors who are very, very supportive. Obviously not everybody's on board, but that's not what we expect. And we have great relationships, and that's what's really, really important in an integrative model of healthcare, is making sure you have those relationships.
And often we actually make a point of letting the specialists know who we're seeing and what we're doing, providing we have permission from the patient to do that.
Yes.
And even if they're not fascinated by what we're doing, they're hearing what's happening.
Yes. Yeah, absolutely.
And
like you say, the proof is in the pudding, right? If
yeah.
Obviously, like you said, more research is needed, and that would be great. But as while we're working on that, if our patients are talking about it and they feel like they're getting benefit, then they're going to be telling their nurses and their doctors about it.
And that's exactly what's happening. Yeah.
So that's really good. So I'm looking at time, and I wanted to ask you one more quick question. Obviously, having gone on this journey for 14 years, and you had a vision before, and it's evolved over the 14 years. What do you think the future of integrative healthcare in Australia is? I mean, do you feel that it's quite positive? Do you have quite a positive sense and feeling about it?
I lost heart a little bit after our first, I can't remember how many years, but when we did seem to lose steam with our research. And I lost heart in terms of thinking we weren't any longer forging very strong integrative links. But as I said, it's coming full circle now, and it's because I think doctors are hearing more about what people want. What people want and what patients want is integrative care.
That's it.
It's being driven by them. So I think the more the doctors have to listen, or the more the specialists have to listen, I think we should, and you should, and we all should feel positive it's going in the right direction. I'm not saying it's easy, and I'm not saying it's all a pushover and it's not going to happen tomorrow, but it is happening in the right direction. And you've just reminded me of something you said right at the very beginning in your introduction about being credible. And, that's something we've strived very hard to be all the way by being not only on top of research, but being transparent and being communicative. We've tried to be credible. But I'll just tell you something interesting. This is ahead of the press, so I'm not sure how much I can say, but the University of Melbourne is starting in a wonderful initiative to help patients know what is credible in this field. So they're starting a website for IVF patients that will critically analyze all the add-ons that you can do with an IVF cycle, so including PGD, including hatching, blastocysts, including embryo, including all this sort of stuff. So they did a survey of 1,600 people, of IVF patients who had done IVF in the last 3 years, and said, just tell us what add-ons you've used. The top three add-ons, first one was acupuncture, second one was PGD, third one was Chinese herbs.
Wow.
Top three add-ons. And so what they have to do now is incorporate in this website an analysis of what Chinese medicine and acupuncture can contribute. And it will be critiqued in an evidence-based way, but I think it'll be well communicated.
And I think that's absolutely fantastic, because it's all about empowering our patients. And I mean, this vision that you had, back in 2008 was about obviously bringing the two together, because the practitioners really like that, because it makes, our outcomes better for our patient. But, I see this massive shift happening, how our patients are really starting to want to be more empowered, rather than giving the power away to the practitioners always and saying to the doctors, what do I need to do? They're researching more. They're wanting this kind of seamless thing, because it empowers them, and they want to be able to ask the right questions.
Yes.
And to have a website that they can go to, which basically says, yes, everything you've heard, or no, everything you've heard, go here and have a look. And how fantastic is that, right? It's really all about empowering our patients too, because, then they're far more likely to get successful outcomes, and it reduces their stress and anxiety when they're empowered like that. So I think that's beautiful. And I think
we should feel pleased about, Lou, is it's our clinic that's going to be on the advisory board.
Yay, awesome. That's fantastic, right? And so it should be, as far as I'm concerned. And it's very much thanks to you and your vision, and thanks to the team over the years, and I know, because I've been part of the team for, what is it, 12 years now, that, how cohesive it is, and we call ourselves the superorganism because we really are. It's beautiful, and it's grown and it's evolved, but it's the core kind of principles of your vision and where we started out are really the same. So putting our patients first and making sure that it's whatever we want the best for our patients, right?
Yeah.
And whether that's an integrative model of healthcare, then that's what it is. So Jane, thank you so much. I know we've gone a little bit over time today, but it was just so interesting to hear you talk and to hear how our clinic has come to be. And happy birthday, 14 years to our amazing Acupuncture Pregnancy Clinic. To all of you guys out there, thank you for joining us. I know this is not a live session. You'll be listening to it on recording, but I've loved this session today. It's been a great session. We hope that this has left you feeling more empowered, because that's really what these Making It on Monday sessions are all about. It's about helping you to navigate your journey, to empower you to have as much information and education that you need to get a better outcome for yourself on this journey. So do let us know what it is that you'd like to hear more about. If you've got any comments or any questions about what Jen and I talked about today, if when that website becomes available, we'll make sure that we're posted in the group. Will be one of the first things we do as soon as it's available. And Amy will be back next week at the same time, and she'll be back on around about the same time, 12 p.m. Australian Eastern Standard Time. So Jane, thank you so much for coming on. Thank you for giving up your afternoon to talk to us. And that's it.
Thanks, Lou.
Bye.
Bye.